What causes heavy periods? And what is a heavy period? So, a heavy period is defined by changing your tampon or sanitary towel 6 times or more in a 24-hour period. And when you're changing it, they're quite saturated, and there's also normally leaking involved. I think it's important to know what heavy is because we all have our own definition of what's heavy for us, but it's good to know what we're looking for exactly. So, what causes heavy periods? In my experience, it's generally an imbalance between estrogen and progesterone. So, you either have too much estrogen or not enough progesterone. So, what can you do about that? Well, if you're on the more estrogen dominant or heavy estrogen side, then quite commonly it can cause things like weight gain. You can get a lot of sore breasts. You might be a bit hot and sweaty, poor focus and concentration. Whereas a lower progesterone is more to do with sleep not being as good, mood also being maybe a bit lower, but generally feeling a bit flatter rather than feeling a bit sort of agitated and hyper. But of course, it can also be a combination of two. Maybe at some point in the month you've got high estrogen and at another point your progesterone's low. So I work with my patients to balance this in terms of getting their periods less heavy and less painful and less troublesome. In terms of supplements, looking at B vitamins that help you metabolize your hormones better is great. Selenium is really great for helping to encourage more progesterone production as well. And magnesium and vitamin C also can help with the progesterone production. So if it's really quite unbearable, I would advise going to see the doctor because we'd also want to rule out something like endometriosis, which is heavy painful periods, and also fibroids. So it would maybe be important to get a scan done or something like that. I hope that's helpful. And if you've got any other questions on periods, let me know.